Good morning or afternoon, depending on where you're located, and welcome to today's informative webinar, Building a Culturally Inclusive Workforce, Building Trust, Enhancing Care, Sustainable Workforce Growth Through Internships. We are delighted to have you join us, and we emphasize skills and knowledge that value diversity and enable effective responses to cultural differences, as well as the importance of internships inside Native American and Alaska Natives communities. Today, we're here to help facilitate the discussion of these internships. And before we go into it, I'm just going to give a quick hello. My name is Molly Siegel. I'm a public health associate with the Technical Assistance Research Center, better known as TARC, here at NCUI. And joining me at NCUI are my team members, Elizabeth Best, Program Manager of Technical Assistance, Amy Lord, Bug Administrator of Communications, and Jessica Gilbertson, Director of Communications and Events. We're honored to have you here today, and we kindly ask that you place your name, organization, and tribal affiliation and title into the chat box, please. Next slide. This event is made possible by the Indian Health Services. This event is solely the responsible of the National Council of Urban Indian Health and does not necessarily represent the views of Indian Health Services or the Department of Health and Human Services. Next slide, please. For those of you that are unfamiliar with NCUI, here's a little background. The National Council of Urban Indian Health, also known as NCUI, is the national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in rural areas. NCUI is a national representative advocating for the 41 urban Indian organizations that are known as UIOs, contracting with Indian Health Services, IHS, under the Indian Healthcare Improvement Act. NCUI strives to improve the health of the over 70% of American Indians and Alaska Native populations that live in urban areas, supported by quality, accessible healthcare centers. Next slide, please. Before we proceed, please note that this session is being recorded for educational and quality improvement purposes. This recording will also be shared to make it accessible to those that may have missed it today or would like to revisit the content at a later date. Next slide, please. Please note, your mics have been muted upon entry. We always encourage participation and engagement in today's session. We invite all the participants to turn their camera on and post any questions and comments in the chat box. There will be an opportunity for a Q&A at the end of today's session. Next slide, please. As we continue our webinar, we encourage active participation and value your questions and insights. To make the most of this interactive experience, here's how you can ask a question on Zoom. Just click on the chat icon, type your question, and hit enter into the group chat. And we do have our communication staff on by if you guys have any technical issues or questions. So feel free to type them into the chat. Thanks. Next slide, please. So we're going to go over today's learning objectives before I introduce today's wonderful speakers. We're going to try to discover the roles of internship programs in developing culturally competent healthcare leaders. We're going to acknowledge the importance of cultural diversity in healthcare training to better understand and cater to diverse patient populations, improving overall patient care and outcomes. And we're going to enhance the understanding of challenges, successes, and best practices when implementing an internship program within a UIO. Let's go to the next slide, please, so we can dive in a little bit. All right, let me introduce our first speaker for today, Dr. Bright. He is the Director of Behavioral Health at Indian Healthcare Resource Center in Tulsa. He earned his doctorate in clinical psychology at Northeastern University in South Florida. In addition to providing therapy and assessment services, Dr. Bright runs the Psychology Training and Integrated Health Program, IHCRC. With him today is Dr. Guzman, who completed his PhD at the University of Tulsa. His focus is providing therapy and assessment services to minority populations across the lifespan in community mental health settings. He's currently working towards his license and postdoctoral psychology residency at IHCRC. And we're so happy both of you guys could join us today and super excited for your presentation. With that, I'm going to go next slide and pass it to both of you. And can't wait. Thank you.
All right, thank you, Molly. So as she mentioned, I am here in Oklahoma at the Indian Healthcare Resource Center in Tulsa. And we've had an internship, a psychology internship, for quite a number of years. I wasn't able to get an exact number, but I believe it's at least been 20 years. Um, I myself am a former intern, and so I can speak a little bit to that, but I also had Dr. Guzman here because, as was mentioned, he is currently a postdoctoral resident, but was an intern prior to that. So I'll start off by talking about kind of what role an internship has played in our clinic. So our primary purpose in our internship is to train culturally competent providers to work that are interested in working with a underserved population, specifically the Native American population. But something that is important to note as well is that psychologists often are not part of treatment teams in community health centers, but they do serve an important role and can serve a unique role in that they're the only providers that are able to provide psychological assessment services. And so, but in addition to those assessment services, psychologists are trained in a number of areas, which I've listed here. Obviously, they provide therapy service as well, but they're also trained in developing programs and evaluating their effectiveness, as well as looking into the evidence basis and research that exists behind interventions to evaluate whether or not there is a strong basis for utilizing interventions within organizations. And then also there is training provided in providing supervision and consultation. So we're including some pictures through here. I don't know that they're necessarily tied to what is in the actual slide, but I tried to pull some pictures of our interns over the years. I've been here since 2014, but I've actually been in a position of supervising the interns for, I believe, 6 years now. And so I tried to pull some examples of not only the interns that we've had come through the organization, but also some of the events that they've been able to participate in, specifically the cultural events. And here is a picture of me and my co-supervisor, Dr. Shadlow, with 3 of our interns outside of our clinic a couple years ago. Next slide. All right, so one of the reasons that it's challenging to have psychologists in any organization right now is that it can be difficult to recruit and hire. I mean, that's been my experience, at least, especially here in Oklahoma. The pool of psychologists is pretty small. And so getting a licensed psychologist that's already established to come and join a facility can be challenging. We've had positions open and had even very few applicants. That might not be the case across the country, but in more rural areas and in certain states, especially within Oklahoma, I know that is the case. And so what we've tried to utilize our internship in one capacity for is on developing a psychology staff here at the clinic. And so we're trying to attract early career psychologists or future psychologists and instill some sort of investment in continuing to work with underserved communities after they complete their internship. And so as a component of the internship year, we really try and have there be training in working specifically with underserved communities and the Native American community specifically. It allows us also to develop our workforce or our future psychologists to be adept at working in a community mental health setting, but also with underserved community. And I included at the bottom kind of the path that happens. So for anyone who doesn't know, an internship is the final year of future psychologist training in school. And so it's the final year of their schooling before they receive their degree. At the end of the internship year is when they'll have their degree conferred as long as their other requirements have been met at their schools. But after that, they don't automatically become a psychologist. They have to seek licensure. And so in order to obtain licensure, they will have to complete a postdoctoral fellowship as well, which is typically a year as well. Once that's done and they've passed their licensure exams, then they can apply for licensure as a psychologist. Next slide, please. All right, so why is it important for us to train culturally competent providers? And not just psychologists, but culturally competent psychologists. And it's because research has consistently shown that those who receive culturally competent care are much more likely to experience positive outcomes from the interventions and services that we provide. And so, what are the components of that? Well, in our internship, what we really try to do and stress when working with our community is the ability to be able to assess our patients' level of acculturation, how connected or not connected they are to their culture. And then also knowledge of adaptations to our traditional treatments for mental health. So a lot of the treatments are Western in nature, and so being able to adapt those to Native American communities is important. And so finding those adaptations and figuring out how to implement them in a way that works for our clinic. Next slide, please. So let me talk a little bit more about the training that psychologists receive and how an internship fits within that so that you kind of can understand where we're coming into this when we're running an internship. So as I mentioned before, the final year of their education is the doctoral internship. And that is a full-time year-long internship, which means 40 hours a week for a full year. And so internships and how they're run are very similar to anyone who has familiarity with physicians and their training. It's run through a match process, and not just you apply and you're accepted somewhere, but there's an actual process where you're matched somewhere. And that match process is run by an organization called the Association of Psychology and Postdoctoral and Internship Centers, or APIC. Next slide, please. And so what the process of establishing and going through the match looks like this. So the first step is for a site that is interested in running an internship to register with APIC as a site that has an internship. And I'm going to have Dr. Guzman talk in a minute about what those requirements are, and they can be kind of a barrier sometimes to people establishing an internship. But so after a site is registered with APIC, it adds them to their directory, which applicants will then review when deciding where they want to apply. And they'll start sending their applications out in the fall. And here at our site, we'll start receiving them at that same time. So we'll review their applications, which are actually pretty lengthy. And we will start to schedule them for interviews. And most sites, if not all, will schedule their interviews in December or January. At the completion of the interview process, both the sites and the applicants independently will create a list of, the sites will create a list of the applicants in the order that they would prefer to be matched with them. And the applicants will complete a list of sites in which they would like to be matched in the order that they would like to be matched. And then both of those lists are submitted to APIC. And then they have an algorithm, which I don't know much about, and I don't know that anyone knows much about what those criteria are. But they're thrown into this algorithm, and then there is what's called match day. And on that day, both the sites and the applicants are notified of which applicants are matched at which sites. And it's important to note that at this point, it constitutes a contract being created. And so once that match has been made, you've made a commitment to that person, or that person has made a commitment to that site. And so I've just kind of walked through the process of the first phase of match, but there's actually 3 phases. The second phase is very similar to the first in that anyone who was not matched or any sites that have openings go through this entire process of application, interview, and then ranking, and then having a second match day. It's more condensed. It happens in a shorter period of time, but it's similar in structure. In the third phase, which is called the clearinghouse, it's much less formal, and sites are contacted directly by applicants, and offers are made directly to applicants after interviews are completed. Next slide, please. All right. So I mentioned before, like the first step of this process is registering with APIC, and that there are quite a few requirements to be eligible to register with APIC as an internship site. And so I've had Dr. Guzman do a little research on kind of what all of those requirements are. I've listed some of the more notable ones here, and he's going to review those, but he's also going to mention a couple of others that are of note. And so, Dr. Guzman, I'll turn it over to you for this.
So one of the biggest, sort of the most noticeable one is going to be that 2,000 hours required. So it's going to be, the site has to be able to provide every intern that they have sort of guarantee that minimum hour requirement, with 25% of those hours being face-to-face client contact. The one that gets a little bit more challenging for people to meet is going to be the supervision requirement, which is 100 total hours minimum. So it comes out to, if I remember correctly, about 2 hours a week of individual supervision. And there's requirements around that, in that it needs to, well, I'll get into that, but in a little bit later, but there's requirements sort of on how that supervision can be provided. There's also the requirement that there's 2 licensed psychologists present at any time to provide that supervision, with didactics occurring at least 2 hours per week. And those didactics have to be in the form of a case conference, a seminar, in-service training, ground rounds. They can be done virtually, but in person is generally preferred for those types of things. So it's mostly not to avoid like the recording, like pre-recorded stuff that they can just kind of play over and over. It has to be something that the individual is going to be able to actually engage with. And then that they have to be able to provide a range of assessment and intervention activities. And those are some of the sort of the main ones, but there are sort of other requirements in that. Sites have to have access to multiple psychologists, which can be difficult for places to meet, kind of as Dr. Bright was talking about, especially in a community mental health setting. There's not going to be a lot of readily available psychologists to provide those types of supervision. The other part of it, and I don't remember if it's in a later slide or not, but is APA requirements. So while these are the requirements in order to line up with APIC, most doctoral programs are going to require their students to go through, there it goes, go through an APA accredited internship. The APA accredited internship actually has a lot more rigid requirements than APIC. They do have requirements on sort of that the supervision, those 2 hours of supervision, only one of those can be virtually. So if somebody were to have to provide 2 hours of supervision that week, that is going to have via virtual means, that's going to have to be balanced out later on, because it can't be past a certain percentage of those hours. They're also much more specific sort of about what goes into applying for membership. So for APA accreditation, sites actually have to go through a site visit. They have to submit a self-study in which they have to go through how they're going to meet ethics standards, competencies, how funding is going to be provided. And that can be quite a lengthy process, especially at a site that's already maybe struggling for resources and time. So those are sort of the main ones. The other one that comes with APA is going to be that the accreditation is continual, while APIC tends to be a little bit longer of a period. So I think that's everything on this slide.
All right. Thanks, Dr. Guzman.
Mm-hmm.
So that's kind of giving an overview of some of the challenges structurally as far as establishing an internship. There are a lot of requirements that are necessary in order to even be eligible to do so. But once that's done, other challenges exist, and that's kind of what I'm have listed here. And one of the things that, at least in our area of the country, that I've been noticing over time is that it's become more difficult to attract applicants here to Oklahoma. And I don't know experiences in other areas of the country, but it is pretty standard here in the state that it's a difficult process. I've been able to kind of talk to other internships here in the state, and they're experiencing the same thing. And so I've tried to kind of break down what some of those factors might be. And Dr. Guzman referred to this. And one of the things that is challenging for especially an emerging internship site, or people that have an interest in establishing an internship, is accreditation. Obviously, in order to be eligible to have an internship, you have to be registered with APIC, which has its requirements that Dr. Guzman was talking about. But what most if not all applicants are interested in, is APA, or the American Psychological Association's accreditation. And as he mentioned, that is a much more challenging accreditation to acquire. It's more time consuming, and it requires that the internship exist in some capacity prior to obtaining accreditation as well. And as he mentioned, there's a site visit that's required, a self-study, a lot more stuff is involved in getting that accreditation. But if you don't have it, it can be much more difficult to attract applicants to your program. Something that I've noticed, especially in the past few years, I'd say the past 2 to 3 years, have been an emergence of concerns about political climates in the state here in Oklahoma, as well as just geographical concerns. So I'll talk about the geographical first. So I mean, many people are, I mean, these are nationwide match process. And so moving across the country is something that people are very careful about doing. And so they want to make sure that the place they're going is somewhere that they're going to be happy just living, let alone completing their internship. And living in a more rural area where many of our underserved communities exist can be difficult to attract people who are not from those areas to want to be there. However, I mean, what I've noticed is the concerns that they have is that, I mean, we're here in Tulsa, which is a city. Most of the things that people are used to having in non-rural areas are present here. I wouldn't exactly call Tulsa rural, but I mean, outside of the city, it definitely is. And so I'm usually able to alleviate those geographical concerns in that regard. The political concerns is something that's changed as laws have been changing here. And what I've especially found that more challenging as far as attracting applicants has been in attracting diverse applicants. So members of minority populations, members of either racial, ethnic, gender, or sexual orientation minorities are much more concerned about moving to an area in which they perceive that their lives might be more restricted or where they might be in danger. And that's honestly the perception of many of the applicants that I've had on coming to Oklahoma. And so talking through some of those concerns, I do believe that that's playing a role in there being fewer applicants or applicants not matching to sites here in the state as often. And then lastly, one of the things that kind of ebbs and flows over time is the balance of internship positions or sites and the number of applicants that are seeking out internships. Right now, in the current situation, there are more applicants than there are positions. And so that means that many of the sites will end up not matching for the year. And so have to be able to sustain their program if they don't match with applicants for that year. In other years, and like when I was an intern, it was the opposite. And that was that it was very competitive among applicants to get a site because the number of sites was few. And that kind of ebbs and flows as you know, programs close because they're not able to match applicants. So yeah, those are a lot of the challenges, and they can be numerous, but I think the benefits of having a psychology staff, as I mentioned earlier, kind of warrant that because it is a unique skill set that they bring to communities. Let's go to the next slide. I want to talk about some of the successes that have existed, at least in our program here with internship. So the numbers that I was able to look at go back to the 2011-2012 year of internship. And since that time, we've had a total of 33 interns complete our internship. And of those 33 interns, 20 of them went on from their internship to work in an underserved community in general. And of those 20, 12 of them went on to work in specifically Native American communities. So that's a pretty good number as far as demonstrating that our goal of kind of instilling some interest in maintaining this work after internship is working. So we've been really happy to hear those things. But also, I mean, as far as like the goal that I mentioned at the beginning, as far as like helping us to establish a psychology staff, we've been very successful with that in the sense that well, as I mentioned, I'm a former intern. Started here as an intern, went on to complete my postdoctoral residency here, and then worked as a staff psychologist for a few years before I started supervising. And now I'm the director of our department, as well as working as a psychologist. In addition to me, though, my immediate supervisor was an intern, and he is a psychologist as well. He was an intern here at our site and has stayed since his internship as well. And right now, in addition to the two of us, which are established here, we have two postdoctoral residents. Dr. Guzman is one of them. And they are getting close to the end of their residency in which they'll be able to obtain licensure. So we're hoping to have two additional licensed psychologists here on staff soon. We also have another staff member who completed their internship here, but is still working on their dissertation and has not yet started their postdoctoral experience. And then we have two interns that are here now, and we're actually hoping to be able to keep one to go into their postdoc. And so we've been able to attract people who are interested in working with our community, doing the work that we do here, and keeping them here to continue that work. And I believe that might be the end of our slides, but next slide. Oh, no, it's not. So one of the things that has allowed us to be able to have our internship, and something that I would suggest to people who are looking to establish an internship, but maybe are looking at some of those requirements and are wondering how would we be able to meet all those requirements, is to look at something which we've always done, which is be a part of a consortium. And so our consortium is a conglomerate of sites that have interns here in the Tulsa area. And right now there are 5 members of our consortium, and other sites are not necessarily native sites or community mental health sites. One other is a community mental health Native American specific site. But the others, one of them is a university counseling center. One of them is at a private hospital where they do some research into interventions and it's brain research. And then one of them is at a forensic center. And so by coming together as a consortium, what that's allowed us to do is pool our resources. And so looking at the requirement that somebody have 2 hours of didactics every week for a year, that can seem overwhelming. But if you're a part of a consortium, then what can happen is you can split that responsibility amongst a number of sites, and then it's much more manageable. The same can be said for supervision. We do 2 hours of group supervision every week, and we rotate out the supervisors that do that, which is helpful in the sense of lessening our workload as supervisors, but also can benefit our interns as well because they get a variety of supervision experiences. And then also we can split the administrative tasks, as you kind of would get the idea when we're talking about maintaining accreditation and doing self-studies and site visits and all that stuff. It's a lot of administrative stuff that has to be maintained. And so being able to split that amongst more people lightens the load and makes it more manageable for us to be able to maintain our internship. So, I mean, I would suggest looking to see if consortiums exist in your area, if that's something that you're looking for, or talking to other organizations in your area that might be interested in having an internship and seeing whether or not some kind of similar program might be able to be established. Next slide, please. All right, so those are that's all the information that I had gathered about our internship. It's something that our clinic really values. It's something that I've enjoyed as an intern, but also enjoyed running as well. It's gratifying to be able to help these students achieve their last step in obtaining the degree that they've been trying to obtain, but also in developing culturally competent providers. Because obviously one of the things that we struggle with is the lack of providers in our facilities. So I think that we have some time for questions. I know I wasn't able to cover everything. And so any questions that anyone might have, I'm happy to answer. Dr. Guzman is also here to speak to the internship experience from that side as well, if anyone's interested.
Thank you both so much. And yeah, anytime, feel free to come off mute anyone or drop your questions into the chat. And thank you both for that. amazing presentation. I definitely learned a lot. And you mentioned the APA site. I had this question as soon as you said it. I was wondering how long it took your organization to become an APA site and what that process looked like. You went into a little bit, but it sounds like there's a lot more.
Yeah, so actually with us, one of the benefits of joining into a consortium is that the consortium is accredited. And so by being associated with the consortium, we were all also able to be a part of that accreditation. And so we meet their requirements in what we provide, and so that allows us to be accredited as well. And then since joining the consortium, we've participated in maintaining that accreditation. And just to kind of give some guidelines about what that looks like as far as accreditation goes. Like, it depends on how long that is. I think the longest that APA gives is 7 years, but the shortest is 3. Um, so that's kind of dictates how often you're having to do a lot of that process.
Appreciate it. And I think kind of feeding into that question, there's a question in the chat from Rachel Allen about partnering directly with programs such as American Indians into psychology at Oklahoma State or various similar programs at various universities, talking about that consortium that you talked about. But do you partner with Oklahoma State or other universities in the area? What might they be?
I'm glad someone mentioned this. Actually, yes, I'm on the board at the AIP at Oklahoma State. I go to their meetings and participate in those. So yeah, no, we've been able to partner with them. We go not only to help kind of provide some resource to their program, but also to kind of advertise ourselves as a site where not only can people working on their degrees come here potentially for internship, but they can also, at times we've been able to offer practicum. And to those that don't know what a practicum is, it is a experience while people are actually still in their training programs, attending classes. It's before they get to internship, some of those clinical practical experiences. So yes, we do partner with the American Indians into Psychology program at Oklahoma State.
You guys are right there. So it seems like a really good partnership to have and definitely bringing in those applicants. And feel free to everyone to drop your questions in the chat or come off mute. But I did want to know, I know I'm asking so many questions, but speaking of applicants, you mentioned, the fluctuation of applicants, how it goes up and down. What is the average amount of applicants you guys have per cycle in the last year or two? What does that look like?
Yeah, so over time we've seen the number go down. I think so when I was applying, I want to say that they were getting 50 to 60 applicants. Um, in the most recent batch of applicants, I believe that we had 16 applications, and we ended up interviewing 13 of them. So, the fewer that you get, the harder it is to fill positions. We used to take 3 interns and now we're taking 2. So that's kind of had to adapt to the changing environment in that match process.
It is competitive, but it's not like, 200 applicants. So it's good to hear that they have some kind of a shot.
Some sites it is 200 applicants, and so it depends on where you're located and how attractive you are to applicants. There's no cap on the number of applications that you can receive.
Oh, goodness. Goodness. Speaking of applicants, another question in the chat. Thank you, Rachel. How actively are individuals with disabilities recruited and encouraged to apply for the internship sites? Are internship sites prepared to accommodate a variety of disabilities? And that's a great question. Thank you for dropping it in.
Yeah, so I would definitely say that they're encouraged to apply. Anyone is encouraged to apply, and definitely does not prevent somebody from being eligible to complete an internship because they have a disability. As far as recruitment goes, not specifically have we gone out looking to recruit people with disabilities, but it's definitely something that doesn't exclude somebody from being considered and probably wouldn't factor much into the consideration process at all, at least for us. We're more interested in somebody's actual clinical experience and interest working in the community and doing the work that we do than we are about those things. And so, are we prepared to accommodate a variety of disabilities? I believe so. as long as people are able to do the things that an intern is required to do, I mean, we are prepared to provide accommodations as necessary. So, I mean, one of the things that I always want is I want a diverse group of interns. And I think that diversity includes diversity of ability. So, absolutely, we would want those applicants here.
I love that answer. Diversity of ability. And
Mhm.
thank you guys for all these questions coming in the chat. It looks like we've got actually some more questions along the lines of accreditation from Kelly Rutherford around how long it took you for your accreditation, both APPIC and APA. And I know we touched a little bit on APA, but
So as I mentioned, we entered into the consortium with that being something that they already had. But I can speak a little bit about what that looks like as far as the accreditation process, because it kind of does have to, it reoccurs. You have to seek reaccreditation at certain periods, depending on how long your accreditation period is. So the accreditation process with APIC, I believe, is usually pretty short. So somebody should be able to do that within, I mean, if they have everything in place, I mean, within a few months, it shouldn't be challenging to get registered if you have the necessary components for an internship to be able to be registered with APIC. APA is longer. And the reason that is because you have to have an established program in order to be able to complete a self-study, which is one of their requirements. You have to be able to demonstrate that you're able to meet the goals that you're saying that you're able to meet. And so you have to have, and so those first couple of years, I would imagine, in somebody who's trying to establish an internship can be challenging because you wouldn't have APA accreditation. And so attracting applicants without that accreditation can be challenging, I would imagine. Um, but once you're able to achieve APA accreditation, I mean, I don't think it's overly difficult to do so. It's just a longer process. Like I said, you have to complete that self-study and then schedule for a site visit, and that can take much longer than the APIC registration process.
so it sounds like the consortium definitely helped you guys not dilly-dally with that process and just be able to get it and retain it. So
Well, I think especially as a smaller organization, we're not a huge, large like hospital or something. And so the resources that we have to devote to this, I mean, at certain points, it's just been me. So me being able to do all of that on my own, like from the ground up, would have been challenging. And so, I mean, I kind of understand that and would say that that's why I would suggest if that's kind of where someone's coming from, that they look at that option of working with other places or organizations that have an interest in establishing internships so that they can both pool resources and divide the responsibilities of doing it.
you're also attracting applicants as well, which brings me to my question, because not that I don't love you answering all these questions, but Dr. Guzman, you're finishing up your program. I'm wanting to know, how's it going for you? Especially with inside this program, what do you find the most rewarding, and how you came across this program and picking it? Just a little bit more from your experience as a postdoc.
I think things are going great. I haven't heard otherwise. So we're gonna go with that. But I think one of the big things that drew me to, being here is one, that minority work was sort of my emphasis, and coming to Oklahoma and seeing sort of the lack of providers just generally available and stuff like that. But I do think that sort of one of the big draws of a program like this is that it can offer that community outreach, that community engagement, whether it be through some of the programs that were pictured, or whether it is just sort of through that more personal connection with your patients, and the fact that you're all working sort of towards a common goal, that I think draws a lot of people in. And then I don't know, from my experience, it is about finding a place that matches that, because that was something that was, I think I'm a little bit of a odd person to answer this question, because we did a facility tour my second year at TU, and I was like, that's where I want to go. And it was very much highly like dependent on the mission of IHCRC. And so, it lined up with exactly what I wanted to do, and was like, that's it. That's where I want to go. So just kind of work towards that. But I do think that being open about values and opportunities and stuff like that is kind of it drew me here. And I think that's sort of the big takeaway is emphasizing those things.
Appreciate the really open, honest answer, and I love that you toured the facility and you just were like, "This is it. This is where I'm going." So I think definitely that consortium and the partnerships within the program that's been developed are being sustainable, and both of you are actually evident of it. So I'm really happy that you were both able to join us today, and I'm just going to open up the floor really quickly to any additional questions. And once more, participants are welcome to come off mute at any time if they'd like, or type their question into the chat. Okay, awesome. With that, we're gonna head on to our next slide, please. Thank you. And we generally appreciate everyone who is on here's time today and effort to help us shape future events. We ask that you please scan a QR code or click the link that's going to be put in the chat box here to take a brief survey. Let us know, hey, we liked this event, we didn't like this event, we're looking forward to maybe this part of an event in the future, and it'll help shape us in the future and what we can provide for our urban Indian organizations. Next slide, please. And we also do want to just plug our one-on-one technical assistance that we have available to urban Indian organizations. NCUE is committed to supporting our urban UIOs and the important work and services they provide every day for individualized technical assistance and everything from agency regulations to UIO billing and coding, filling out and submitting our technical assistance form, also being put into the chat box and found on the link and on our website. We encourage it, and we're providing it here. So if you guys would like some TA, we're here for it. So please click the link and fill out below. Next slide, please. All right. I believe this is the last plug. Register and join us for upcoming events like this one. We're throwing the link into the chat box for our NCUE events page. Our next event is on April 4th, Insights and Strategies for STI in HIV Prevention and Treatment. This event will overview the findings and recommendations from the 2023 NCUE STI questionnaire and promote peer-to-peer knowledge sharing on STIs and HIV. In addition to that event, there are others listed on our website, including our NCUE annual conference. Registration is open, so please register for our conference. It is the end of next month, and we would love to have you there. In addition to our infection prevention control team, so many things happening right now. They're accepting applications for their project First Line Photo Voice project. So we encourage you to check out that link as well, being put in the chat box. And check out our NCUE website. And next slide, please. And I would just like to give a wonderful thank you to our amazing presenters today. I definitely learned a lot about your program and the APA and the APPIC, so many acronyms in Indian country, but totally cool. And I couldn't thank you enough. And thank you for joining us, participants. And we look forward to seeing you all at our next event. So thanks, everyone.